about transition from nursing homes and diversion. So we would love to hear, first of all, if you have any, if you have a program already, if you'd like to share a little bit about what you're doing in your program, if you have information on maybe how you're funding it, any kind of information that others might find beneficial. And for those of you who don't have programs, feel free to just share a little bit about some of your struggles and barriers. And if you have questions for your peers, really the hope is that this is going to be an opportunity for sharing back and forth of information. And I just want to make one more quick look here for, we did have one individual register for ASL, so I wanted to make sure. They're here. They're not here. Okay. So I guess with that, why don't we go ahead and start? And then if anybody would feel.
We follow them for a year anyway, but sometimes the MCOs, sort of set their own milestones. And then we've been able to negotiate some value-based enhancement rates for like the flu vaccine and sort of wellness checks and things that, associate to the MCO in a value-based payment from the Medicaid or is a cost saving. How we negotiated our contracts.
Thank you, Misty. One follow-up question, if I can. So are the reimbursements that you receive enough to be able to fund a position or a part-time position, or do you have your SIL staff just kind of do this as part, one of the many things that they do? Just trying to get a sense of how much volume you guys have.
So for us, we've been able to create the first year that the MCO rolled out, our payments were not appropriate. So we sort of were able to use the services that we had and the payment, the programs that were making enough to substantiate covering that first year until we could renegotiate our contracts. And then once we were able to show that value-based payment to the MC, then we were able to negotiate better rates. And so the payments are enough that we have, I think last year, we may have transitioned somewhere between 100 or 158 and 163. I can't remember, somewhere between those two. And we had about 4 or 5 transition coordinators. So again, we covered 38 counties and had 3 MCOs that we were contracted with, if that helps.
Yeah, no, that's great. Thank you so much.
You're welcome.
Awesome. Teslyn, did you still want to add to that conversation?
Yeah, I can. I realized mine's sort of a different situation. So to kind of explain, so in Arizona, we don't have the money follows the person program, unfortunately. And so we do a lot of our transition, all of our transition work through Arizona's long-term care system, working directly with their health insurance. And then we set up a contract, ours are called Mercy Care and United Healthcare. We set up a contract with each of them where they authorize me as the
sorry, Teslyn, can I pause you just for a second? I don't know if this is just my you're kind of going quiet all of a sudden.
Okay.
Nope, not only you.
Okay.
How's it sound now? Is it
still? Can you lean in a little more? Maybe try. There.
Okay.
There you are.
I'll talk up. So in Arizona, how much did you guys catch? I'm not sure.
We didn't hear most of it.
So in Arizona, we don't have money follows the person. So what's happening? My audio. We don't have money follows the person, so we contract directly through Arizona's long-term care. I'll type it.
Thank you. I'm sorry. I'm actually really interested. I just had somebody ask me about what folks do when they don't have money follows the person. While you're typing, Samantha, do you want to share?
Yeah, can you guys hear me?
We can, yeah.
Okay, I just got hired in January to actually start the program through the state of Indiana. Right now I'm just working in the one current county that I live in. But I'll be perfectly honest, I have no idea where to even start. We've tried getting in contact with Money Follows the Person. Right now, my role is a grant from the state. So the state decided that this was something we needed to look into. And so they approved a grant to the centers that wanted it. And so we took them up on it. So that's been sort of interesting.
Does anybody have thoughts for Samantha? No. Does anybody else want to share or have questions?
My name is Michelle. I'm from OSIL, Ocean State Center for Independent Living. I do the nursing home transitional program for the state of Rhode Island. And the way we work with nursing home transition is that we also have a home modification program that assists people to modify their homes to help them, age in place. So we do work with Money Follows the Person. We also have funding that we utilize if they don't have Medicaid or neighborhood health. And we, fund their transitions if they're within our income guidelines through that as well.
Awesome. Thank you. That's great. Does anybody have questions or follow up? I just love hearing that so many people are doing it. I just, this is actually one of the reasons we wanted to hold these calls, is to find out who's out there doing this work. How are you doing it? And can we share information with each other? Who would like to share next?
It's Darius from Access Living, Chicago.
Yeah, Darius.
I was hesitant, should I even start, because our program is a little complicated, but I want to share it because it might be a last sort of resort for you if you cannot get the funding. So for us, particularly Chicago and our county, Cook County, we get the funding through the consent decree. So about, 12 years ago, several organizations sue our state basically for not providing services for people in the nursing facilities. So as a result of it, initially the managed care organizations were handling the medical side, and our seal, for example, a couple other organizations also were mainly subcontracted to do the housing search, like purchases of furniture and things like that. That changed recently, so other social services organizations took over the role of the managed care organizations. We still primarily subcontracted, but that's only for our county. The rest of the state of Illinois, it's through the state contracts. But yeah, if the MFP it's not an option, and the state it's refusing funding, maybe that's what your state needs to do. Just sue the state.
Thanks, Darius. I think does anybody have questions for Darius on what that looked like? While folks are getting ready to share, I do want to go back to the chat. So Teslin says, in Arizona, we do not have Money Follows the Person. So we go through Arizona's long-term care system. Our two main providers for this are Mercy Care and United. We set up individual contracts with each of them to authorize Ability 360 as the service provider for their community transition service. This is a set stipend amount, and a portion of it is set aside as our admin fee for my work. The rest goes directly to helping the member purchase essential items or pay their deposits. Unfortunately, this means I can only really assist people with one of those two insurances. I'm trying to grow our program beyond this and would love any ideas or feedback. When I inherited the transition program, it was very small and barely staying afloat. Since we cover all of Phoenix area, I know we're missing many individuals. That's great. Does anybody have thoughts for Teslin on how they have a program? Is there any ideas on how they might be able to expand that? It's okay if nobody has an answer right now either. You can think about it. If you have ideas, feel free to raise your hand, or you can put it in the chat. I just wanted to add that Carrie also says we don't have money follows the person in Utah. We have a new choices waiver program to help with in-home care. However, the person needs to go into a skilled nursing for a minimum of 90 days, unless they have a home to go back to. They may be there for a long time due to the lack of affordable housing. Who else would like to share? Does anybody have thoughts about those comments or want to share about what you're dealing with in your communities or your programs?
I can go. I am from Utah as well. I work for Active Reentry in Moab, Utah. I feel like after hearing everyone else talk, it seems like ours is a little bit, I don't know, less involved or just different, I guess. A lot of what we do is assistive technology. So that would include like, we get state and federal funding for like aluminum ramps or mobility scooters, things like that, that insurance isn't going to cover to keep someone staying in their home or transitioned out of a nursing home into their home so they can get into their home. Or it can be something as simple as a walker or a shower chair, and that can also be counted as like diversion or transition, either way. But yeah, that's where we get most of our funding is state, and then federal, like through Department of Workforce Services is who we work under. And then we also get donations and do a couple of fundraisers per year.
Awesome. Do you mind sharing a little bit about the fundraisers? So you use the fundraise money to help transition folks out?
Yeah, I mean, our main IL center, I'm just a satellite office, but our main one is like 2 hours away from me in Price, and they have been around for like 35 years. And for many of those years, they've done a 5K, like they call it the run, walk, and roll 5K. So they get donations from, they go around and ask local businesses, and people can just donate, write a check, whatever. So that's a big one. And then we recently started doing a candy fundraiser through like C's Candies, where we had them, make a page online where you could go and choose from, 10 or 15 different products, and then the money went mostly to us. Those are the two. We don't do a ton of fundraising, and then every once in a while we get private donations. We've gotten a few from like businesses or like kind of, I think it was like a oil or railroad company, things like that. But we don't do a ton of fundraisers, really. It's just those two that come to mind. I've only worked here for a couple of years, but yeah.
Thank you for sharing that. I think any tips people can get, they're happy to get. Cynthia says that they do the annual Highmark Walk for a Healthy Community in Central PA.
Can I add that at the center I currently work at, we already have like an independent program, independent living, and we have an older independent blind program. So we're already tied in with that. So the people that I have helped come back home from nursing homes already, we've been able to get them what they need. And a lot of, compared to what I've heard everybody else do, a lot of what we already do could be considered diversion, because we're providing the rollators and the ramps and making sure that they can stay at home and be independent and safe while they're there. So
Thank you for sharing that, Samantha. I do want to check into the chat. Lorena says that they're working with the North Carolina Department of Health and Human Services Transition to Community Living Program. They're partnered with the SIL in Raleigh to help provide eligible adults living with serious mental illness the opportunity to choose where they live, work, and play in North Carolina. This initiative promotes recovery through providing long-term housing, community-based services, support employment, and community integration. The contract for that is through partners. It's with Partners MCO. So is it managed care organizations? Great. What other questions do folks have about? So for those of you who are joining us to learn today, do you have questions about starting a program or expanding your programs?
I have questions. This is Rebecca from Access to Independence in Madison, Wisconsin.
Yeah.
How are people handling the, what can I say, the low rate of home care? Because I know here we just can't find the workers to do the home care. There's just nobody there to work.
Does anybody have thoughts? On addressing the low rates of home care providers or increasing folks in that field? Anybody have some ideas? Yeah, Jenna.
Hi, so I know I'm from Wyoming Independent Living, and I know that one of we're a very rural state, and we have a huge problem with finding providers. And so I know with the Community Choices waiver, there's the option to hire your own and do the self-directed. So folks that are struggling to find providers, we encourage them to look at that as an option.
Thanks, Jenna. Do others have thoughts on ways that you can address the caregiver shortages?
This is Michelle again with Life Inc. We're currently coordinating with one of our MCOs about establishing like an emergency pass program because of the lack of attendance. That's no reason for people not to be able to, get up out of the bed and get that first meal of the day and have help with bathing and everything. So we're in negotiations with them to provide that emergency, meaning, and the way that that's being set up is that we would provide 2-hour minimum of emergency provider services, meaning that we would go in and help with the ADLs, the basic ADLs, and make sure that it's authorized by the MCO, of course, but it's a pilot program that we're working with them on right now. And we're talking about paying the providers anywhere between, $15 and $20 an hour plus mileage, which is something they don't get. Now, this is just a filling the gap. It's not any, it's not, we're trying to increase the pool, but one way to increase that pool is to increase the amount of pay because they're not being paid what they're worth. But that's just our way of stepping in and trying to fill that gap. That's the shortage of attendance is, I guess, is all over. But like I say, that's just our way of trying to fill that gap until we could get more attendance, and increase that pay, because we're also going through a legislative session whereby we're advocating for at least a starting base of $15 an hour.
Thank you, Michelle. I wanted to say Lorena also said that they're actively advocating for increase in pay for DSPs. So for those direct service professionals. If anybody wants to share some, legislation that they're working with folks on in their state, or some messaging that they're using, feel free to email me. I'll plot my email in the chat. It's mwillard@april-rural.org. And we can get, my hope for this group is that we can also get as many resources as possible to share out, so that, it might not be exactly what you need in your state, but you don't have to start all the way fresh if you have something to start from. So please send those. Candace. Candace Klein?
Sorry,
Oh,
it keeps going away from me when I keep kind of unmuted. This isn't really, I don't know if this is more of a comment or a complaint, but what I'm finding in Florida specifically is that especially when DCF stepped in and started doing all our clearinghouses for anywhere from our peer support to our DSPs, they made it so much harder for people to work with anyone, children and elderly. And don't get me wrong, I understand that there has to be some standard, but we had approached this 10, 15 years ago where we were doing second chance for people in recovery, people who had mental health issues, who were, getting over to be able to get into the field and give back. And a lot of them have records, and a lot of them have records for felonies, for violence against law enforcement when they're getting arrested for not taking their meds. And these are the people who should be in these type of fields, and we're demonizing them for them having mental health issues or having marijuana charges when they were 18 years old. And then we're sitting here wondering why we don't have a field to help the elderly, or why people can't find work. So I don't want, I know it's a little bit of a complaint, but I feel like in our state, that's our issue.
I think that's a really great comment, though. Has anybody dealt with that? Have any potential, solutions or advocacy around that issue? Or just want to share that you're also struggling with that? While folks are getting their hands raised, I'll go to Teslin said in the chat again, and she's in Arizona, right? That their home care service really encourages family or friends to get trained as paid caregivers and provides all the training necessary to hire them. And Michelle says at OSCIL, we get funding through the state and federal government in addition to money follows the person. So we have a home modification where we refer to once a person transitions for ramps, grab bars, shower chairs. We also have smart home technology with smart home hubs and keyless entry, or small bulbs through office, or my thing just moved, through Office of Healthy Aging for those recently transitioned. We also have a small budget and help with furnishings, housewares, and OSCIL also assists with the application assistance for Medicaid and housing if they need subsidized SNAP, Meals on Wheels, etc. Michelle, do you mind sharing, where is OSCIL?
So we're in the state of Rhode Island.
Great.
We have an office in Warwick, and we also have an office in Pawtucket. But we service all of the state.
Awesome. Thank you for sharing that. Does
You're
anybody
welcome.
have questions while we have Michelle live about that program?
So I called them.
I love the idea of the smart home technology.
Yesterday.
Yeah, we partnered with the Office of Healthy Aging through the state
Okay.
for the smart hubs, the smart light bulbs. So if somebody, let's say can't turn on light switches on their own, they can use their voice activation to do so. With regard to keyless entry, they could either do it through their phones or they could use their voice as well, for people with mobility issues. So it really helps for a person to stay as independent as they can in their homes.
Thank you. Joan, did you want to add to the conversation?
This is Joan Romanapp, and I'm from Maryland, and we provide services in the Anne Arundel County and Howard County sections of our state, which is kind of western area, and the Annapolis general area between Baltimore and Annapolis. And I just wanted to add a comment with regards to the person just talking about Florida and charges against people and stuff. Here in Maryland, marijuana has just been legalized for recreational use. And because of that, our legislators are working on the possibility, especially in Baltimore City, for eradicating people's charges that they had in the past for just, small amount of pot and stuff like that, so that then it would be erased from their record. And then that would open them up for job opportunities. So hopefully that will happen.
Would you mind, Joan, if you have anything on that, would you mind sharing it, emailing it to me, and I can share it with the group?
I'll look into it, and I certainly will.
Oh, thank you so much.
You're welcome.
Yeah, Ebony.
Hi, I'm Ebony Payne. I am part of the Institutional Rescue and Recovery Coalition, the Silver Group, as well as the steering committee. I am also a resident in a nursing facility. I was invited by Alyssa from April, and just to kind of give you guys some possible insight on what the transition process looks like from a resident's point of view. I am part of the Colbert-Williams-Ligas consent decree. I've been a part of this consent decree since the class action lawsuit, which thus created it. And that was many, many years ago. I have been actively trying to transition since 2018 of this year. I'm sorry, 2018. But we have had many setbacks, COVID being one, but also the process of going through and getting like your DON score, which is your determination of needs. They were very hesitant, I would say, when trying to do that determination of needs. We had to go back. They even tried to say, well, give us 3 months. We need you to reach these scores or reach these goals. And one goal in particular, they would call me and say, oh, well, we noticed that you didn't make it to 3 of your doctor's appointments, and what's going on there. And when I would inform them that it's a transportation issue on behalf of the facility, they didn't arrange transportation, that became a goal. And I'm like, well, how can I control something that the facility is supposed to take care of? They were like holding things that the facility was supposed to provide against me. Like medication. Oh, we heard you're not taking your medication. Why aren't you taking it? No. So it's rather difficult, especially if you are a person like myself. I am a quadriplegic, meaning I am paralyzed from the chest down. My injury is C4 incomplete. So it's like the more help you need, the higher your DON score is, it seems the more difficult it is to transition out. I actually helped 6 or 7 residents in the facility that I am in actually transition out, and they've all entered the program after me, and they've gone out of the facility before me, but again, they needed less help than I did. So fingers crossed, I'll be calm before this year is out, but it's quite difficult. And also to add to the young lady from Phoenix, I believe she said she wanted to work with more insurance companies. And I was just wondering if she had reached out to, like, usually the insurances have a transition team. If she could possibly reach out to them to try and garner some type of relationship in order to help transition residents out. Just a suggestion. But
Thank you.
yeah,
Thank
no
you,
problem.
Ebony. Thanks for sharing that. I think it's always good to refocus our purpose, I think. And just, again, just illustrating, I think that's not just an issue where you live, it's the issue we're all facing, I think. I can't believe it's already 12:47 Mountain Time. We're getting closer to the bottom half of the call. I wanted to just check back in quick to the chat and say, Amy says that in Utah, they just got an okay for the legislature for all 6 IL centers in Utah for ongoing funding. It'll include a new minimum $15 an hour for the new hires and possibly raising for existing employees. Amy, that's great. If you would be willing to, I don't know if you'd be willing to share anything, some links to some of the messaging you've been using that others could follow up with.
If you mean as far as like how we tried to present it to the legislature?
Yeah.
Or
Yeah. So how did you get that through?
it took years. It took a long time, kind of ridiculously long. I can get in touch with there was one gentleman who works for another IL center north of here who we kind of have to credit him, I think is what it sounds like. He really just went for it. He worked really hard. So I don't know exactly what he did. I think it was the biggest thing I think this year actually that I can tell people is we had a lot of our consumers and just anyone write letters, emails and texts to the actual legislator body, like just to, our local representatives. I think that is what finally got us this year.
Great. Thank you so much for sharing that. Yeah, I'd love to learn more.
Darius from Access Living and Gain.
Yeah.
I don't know if I should chat because I don't want to be like the bringing, negative messages, but in Chicago in particular, the rate for PAs for personal assistants are $17.25, I believe, recently. It really doesn't help to recruit more people. So I wonder if it's, just the times that we live in or something, people are not interested doing this kind of job anymore. But as an advice to other CEOs and things like that, so personal assistants and homemakers are unionized. So the union, local union that basically they fought for the increases in salary, like in the hourly wages for them. Recently, actually, employees of nursing facilities joined the union too. So I don't know if that's an option, if there are any, legislation in your state that, it's against that, but maybe, starting working with local union and then more people, more power you have.
Thanks, Darius. I did just want to check quick into Lena in the chat says that they're in Southwest Virginia. Some parts of our services are rural. They have a DME closet, a durable medical equipment closet for equipment not covered by insurance. They use grants through Virginia Housing to address home access needs for renters and veterans who rent or own. And for those who own their own home in a rural area and are 62 or older, they use the USDA Housing Modification Grant or loan for housing. So thank you for sharing that. I know That's always a really big struggle. For transition is finding housing once you get them transitioned out. Awesome. So we're getting close to the end here. I just wanted to, I'm going to do one more scroll through the chat, make sure I didn't miss anything. I did want to say there was some agreement with this idea of working towards advocating for felons to be able to be direct service providers. I'll give a little shout out that we will be, during this transition series, next month in April, we're going to talk about guardianship and how that really affects transition. And then in the following month in May, we're going to be talking about transition from incarceration and supporting those individuals. So maybe we could dig something up about, I love the idea of trying to marry these two barriers together. So folks needing work, people needing, in-home care. I didn't know, is there anything else, anybody else that wanted to share towards the, I know, awesome, Candace?
No, for what I was saying, it's just a bone of contention for me. We can't say that we don't have a workforce when we have people who are willing to work. But I know here the local workforce boards, they're all under Employ Florida or something, Career Source Florida here. They do have programs and they do train people into some of these fields, and they're having the same problem. So I was told that that was something they were trying to get to legislature to try to say, we're the ones who are responsible for training these jobs that are in each of these communities, and you're holding our hands by saying these level felonies can't work in certain fields. And we have a huge, so many people are moving to this area. We have, especially Brevard County, we have more assisted living, we have more SNFs and SEALs than any other part of the state. And we don't have people to fill these positions on all levels. So there's got to be some compromise somewhere.
Does anybody do a partnership along those lines?
I know there was one before that was out of Orlando that helped seal and expunge records if they were minor felonies and most misdemeanors, but that program went under. So there are no other programs that I know of in Florida that helps trying to bridge that gap. Unfortunately, and I hate to put politics in this, but this is a Republican-run state, and they just, the reform is just not something that they care about here because this is a tourist state. So.
Thank you. Thanks for sharing. Yeah, Misty.
Yeah, the speaker right before me, it was interesting when she said about, workforce shortage. Specifically, our nursing home transition coordinators were having a difficult time keeping them because we are in a managed care run state. Oftentimes, MCOs are poaching our nursing home transition staff, and that's become a huge problem for us. It's hard enough to keep and retain staff, but when you're dealing with the for-profit managed care organizations, it's even more difficult when they're competing with little sills like us. So I didn't know if other people were having similar experiences around that.
Thanks, Misty. And I think we have time for just one more. Deb, go ahead if you wanted to add to that.
Hi, yeah, I was just gonna say that I'm in Wisconsin. We had recently sent one of the, the care coordinator. So she works with those phone calls for the MAPC agency portion of our center. And she had just attended like a seminar to learn what are these permanent bar things and what are the things that we can overlook, because if we're the employer of record, we're that mitigating factor. And then it becomes more our choice. So people who are told no in some of our self-directed programs, they can't hire this person because they're on that permanent bar list. We can consider that so that people still have a choice. They can still have their loved one, even though, you know, their son may have wrote a bad check way back when he was, you know, like in his 20s or something like that, but he's the best caregiver for mom now. So we're the mitigating person. Instead of saying, no, we can't hire them, we will take on that risk. We look at that, you know, so that I think that was very helpful to send someone who gets all those immediate phone calls to say, you know, I want to hire so-and-so, I want to come to your agency and for my personal care services, just knowing what are absolutely not, and then what are things that we, just being an employer of record, we can mitigate that so that someone still has a caregiver and who they want, who they trust in their home.
Thanks, Deb. I think that's really great. Great. Ebony, sorry, I see you mentioned the 3 bills in committee. Did you have something else you wanted to add to take us to
No,
the
I
end?
just wanted to make sure because you had spoken about legislature before, and I believe one of those bills specifically speaks to forming agencies that can help specifically to stop the nursing home, the hospital to nursing home pipeline, and to allow for a transition program specifically for persons who are already in nursing facilities.
Thank you for sharing that. And we'll make sure to pull those bill numbers out from the chat. Oh my gosh, here we are at the end of the hour. Wow, we could have spent a long time on this group. We're very fortunate again. Thank you for this partnership with the ILNet and April to offer this peer series on transition. Hopefully it's something that we can continue next year. But for those, again, who registered for this call, we will follow up with any materials from the chat and the transcript. And if anybody would like to share information, again, you could email me at mwillard@april-rural.org and we'll share it with the group. We'll also be sending out an evaluation, and one should pop up in your screen when we close out. So please feel free to fill that out and let us know what you would like to see again in the future. Thanks, everybody, and have a great rest of your afternoon.